you the link to the recording early part of next year, so that you will be able to access the recording in the future. Tonight's webinar is being hosted by members of the Parkinsons UK education team. So we're just going to quickly introduce ourselves so you know who we are. My name is Tracy Anderson. I'm the virtual learning manager within the team and your host for tonight's webinar. We have also Jasmine Handel, who's our education officer, and she is providing all the tech support and monitoring the chat rooms and the chat boxes for us. And we have Mike Innes here as well as the education lead, and he will be taking you all through the presentation itself. And just to have a quick look at our agenda for tonight's session, we'll have a quick introduction to the Parkinsons UK Excellence Network. Mike will just be showcasing some of the main areas of support and services that we have in collaboration with health and care professionals. But the main part of the presentation will be around our education offer, and Mike will be taking you through our 4 work streams and how we work collaboratively with not just health and care professionals, but people with Parkinson's to provide, develop and maintain good quality education. There will be some takeaway points, also some action points to look at, but don't worry, nothing too major in our ask for tonight's webinar. And there will be a brief Q&A session. There are some pre-submitted questions that we have, but during the webinar, if you do have any questions that come to mind, please do add them into the chat room, into the chat box, which you can find at the bottom of the Zoom window, and we will be monitoring that to see what questions are coming in. If we don't have enough time to answer all of those questions, not to worry, we will be following up those questions in an email at the start of next week. And on that note, I think I shall hand over to Mike Innes, who is our education lead, to take you through the main presentation.
Thank you very much, Tracy, and good evening, everyone, and a very warm welcome to the session. It's fantastic to see you here on what is a beautiful, bright spring evening here in Milton Keynes. I hope it's as pleasant and lovely where you are. As Tracy's explained what we're going to be covering, what I'm going to do now is jump straight into the first part of the presentation, and I'm going to talk briefly about the Parkinsons UK Excellence Network. So the Excellence Network was set up 10 years ago to help health and social care professionals to provide better support for people with Parkinson's. And now in 2025, the network comprises, an extended series of regional networks. So these are local groupings in which to share knowledge, improve skills, and drive change. In England, the network mirrors the 7 NHS regions. There are 3 in Scotland, 2 in Wales, 1 in Northern Ireland. Just last week, I was lucky enough to attend a session of the Northwest England region in Liverpool. That was a fascinating series of presentations, discussion groups, and opportunities simply to share perspectives and talk things through with fellow professionals. Such a worthwhile experience. But as well as the regional offer, the Excellence Network hubs cover priority areas of special interest within Parkinson's. There are hubs related to areas of practice, including exercise, mental health, pharmacy, deep brain stimulation, and speech and language therapy. There's also a Parkinson's Clinical Excellence Network. Join the Excellence Network and you will receive a monthly e-newsletter containing all the latest news and up-to-date information. And speaking of information, in support of the network, charity staff also collate and present via the web a directory of conferences and events, and an extended set of resources, including access guides, assessments, and case studies, all you need to expand your knowledge on best practice and to improve service delivery and outcomes. If that wasn't enough, there are also funding opportunities, including small and large grants aiming for improvement in services, reducing health inequalities, and building an evidence base for best practice care and sustainability. And specialist nurse pump priming has, since 1996, invested more than £12 million, with almost 2/3 of Parkinson's nurses having been initially funded by Parkinsons UK. And since 2022, there's been funding for allied health professionals and mental health professionals. And finally, we come to the Learning Hub, our main focus for this evening, produced and maintained by the charity's dedicated education team of 7. So, to turn our attention to the professional education provided by the charity through the Excellence Network. It's all available on the Learning Hub area of the charity website. If you want to look now, you can do so using the QR code. You may prefer just to concentrate on the presentation and check things out at your leisure. It's important to stress right from the start that all the professional education I'll be talking about this evening is available to you at no cost. The charity takes the view that the provision of Parkinson's-related education for health and social care professionals is so important, it wants to make the barriers to access as low as possible. When it comes to our online courses, some of our learning requires you to make an account. Some of it, we don't even ask you for an email address. It's simply available direct from the Learning Hub on the Parkinson's UK website. Everything is free. What do you get when you engage with our learning? At a top level, you get CPD, which is designed to upskill professionals to improve care for people with Parkinson's. You get CPD that's developed in collaboration with subject matter experts who are current practitioners and who provide clinical knowledge and best practice. And I'll be talking more about both our planning and our collaborative processes later on, with the opportunity for you to get involved. So what is the professional education offer? There are 4 main pillars, each accessed through the Learning Hub. So in no particular order, an introduction to Parkinson's is a live webinar aimed primarily at nursing home staff, care home staff, and people in roles such as domiciliary care management. The webinar balances information about the condition with practical steps to improve care in the relevant context, and each session is delivered by a member of our volunteer team, all of whom have direct or indirect experience of the condition and so are well placed to bring the subject to life. This is a very popular area of our provision, and shortly I'll talk about an example of a team of staff reflecting on and improving their practice as a result of attending the webinar. Moving on to our online courses, these are almost all in the format of self-guided study, meaning an individual learner can work through a course at their own pace and at a time that suits them. As I mentioned, for some courses you need an account, for others you don't, but the point is if you have an internet connection, you can access learning wherever you are and whenever works for you. Our online courses are different lengths, different levels, different themes, some for more general professional audiences, others are more specialist. We're adding to the Learning Hub new and updated courses all the time. Recent examples include a suite of 6 courses called Parkinson's Essentials, each of which is aimed at a different professional area. For example, mental health, pharmacy, and OT. There's also a new video aimed at ward staff, intended to be viewed and discussed together in team meetings. And another course launched just last month is Navigating Parkinson's Research with Your Patients, which aims to give healthcare professionals the tools and confidence to talk with Parkinson's patients about participating in medical research. The Parkinson's Essentials courses and the ward staff video have a duration of 15 minutes plus reflection time. Navigating Parkinson's Research is 30 minutes plus reflection time. We also offer via the Learning Hub the opportunity to become a Parkinson's trainer as a short program comprising online study and engagement with further learning materials to develop training skills. And last but not least, we provide 4 professional learning libraries where we collate and present information and links to education courses and resources which are Parkinson's related but are produced generally by other organisations. Anyone can access them and browse to find learning opportunities to improve their Parkinson's skills, knowledge and understanding. As you can see, there are 4 learning libraries organised by professional area: Parkinson's nurses, pharmacy, therapists, and health and social care. So next, I'm going to talk about how we work in the team, with a particular focus on our online course production processes. The key point to make here is really the bringing together of necessary professional skills from inside and outside the charity, all in the service of an education program that concentrates on improving the lives of people with Parkinson's. So how do we decide what courses and what sorts of courses to produce? How do we plan our curriculum? There are 4 main drivers that inform the choices that we make. The first of those is plain and simple market research. We do carry out formal market research. For instance, last year, we conducted a series of interviews with allied health professionals to understand more about their learning needs, the gaps they have in their knowledge and understanding around Parkinson's, points around accessing education, how they feel they best learn, and broader attitudes to CPD. From our point of view, examples of key takeaways from the market research process were to do with the applicability of learning, the practicality of learning, and the importance of meeting the needs of a notably time-poor audience. The courses I mentioned earlier in the session were developed with these principles very much in mind. In other words, we are demonstrably responsive to feedback obtained by these sorts of means. Onto course feedback and evaluation. We ask learners for their feedback and comments on completion of a course. And I do need to underline how important this is. You know how if you do something online, you're always asked for feedback on the experience and that sort of thing. I can't speak for other organisations, but I can tell you that we really appreciate feedback, we really take it seriously, and we do use it. It's a key way of helping us to understand what the audience that we serve want and need. It's a simple way to gather information that we can use to help us to improve. And similarly, we do record and monitor data from our courses to help us to learn how they are performing. A current example is that on a particular set of courses, learners report that on completion of a piece of learning, their confidence and their knowledge and understanding have both increased, but confidence increases at a consistently lower rate than knowledge and understanding. Why is that? And what might we do about it? Questions like that we can build into our formal review processes. Thirdly, there's the UK Parkinson's audit as the recognised quality improvement tool for Parkinson's services. The audit runs every 3 years and is aimed at services that support Parkinson's patients. It has broad application in informing service improvement, not just the charity's education provision, but as an example again of our responsiveness, the audit highlighted the low level of bone health assessment being completed. Consequently, as part of a project to promote the importance of undertaking assessment, we developed a course on bone health plus an accompanying set of tools. And fourthly, we also draw on the experience of the Excellence Network steering group for further perspective and insight from steering group members. For example, we have been pleased to receive feedback based on the significant professional experience of steering group members, which has helped inform plans for our largest current project. That's a new programme of courses aimed at providing foundation level knowledge to meet the needs of a general professional audience. Steering group members have influenced not only the subjects to be included, but also the way that they are configured into courses. To support the production of almost all of our online courses, we collaborate with clinical practitioners in the role of subject matter experts. These can be in different roles, as authors who draft materials and provide clinical knowledge, as peer reviewers and clinical reviewers who provide feedback on drafts, advise on the alignment of content and learning outcomes, and provide insight on overall subject coverage. And our SMEs tell us about a range of motivations for working with us. These can be to support the charity, to support the Excellence Network, or education specifically, or perhaps to develop new skills as a course author or reviewer, to work on a new type of project, perhaps to have something new to put on their CV. We're more than happy. We happily credit all of our SMEs. And as you'll see from the quote on the screen at the moment, we also have lived experience SMEs. Alan is an example of us collaborating with people with Parkinson's in online course production. The same is true of the Introduction to Parkinson's webinar that I mentioned earlier, providing invaluable perspective and helping us to centre the voices of people with Parkinson's. The skills that we're lucky enough to have in the team which contribute to online course production are a blend of managerial, technical and pedagogical. At heart, what this enables us to do is to produce courses which take materials developed in consultation with our SMEs and use them to form the basis of compelling online courses hosted with integrity and to accessibility standards, drawing on appropriate learning theory, using relevant interactive activities and video content. So why do we go to all of this effort? So I've touched on matters to do with the impact of the charity's professional education. Now I'd like to shine a light on the point of it all to improve the lives of people with Parkinson's. Firstly, these quotes from learners highlight a point we emphasise in our learning to do with reflecting on current practice, helping to bridge the gap between a course and the making of practical improvements in care. Because completing the course is only one part of learning. It's about putting things into practice. The point of the charity providing professional education is to improve the lives of people with Parkinson's. So I and the team are interested in what changes may occur in service delivery, for example, to do with correct med times, appropriate levels and types of support. We want to hear about those stories. We want to hear about those stories. We want to hear what's changed. On the next two slides, I'll be talking about a real-life case study which demonstrates the point around learning as a prompt for change. So the circumstances of our case study is a chain of care homes. The family of a resident of one of those homes worked with staff around matters to do with time-critical medication, which was affecting the residents' concerns. This exploratory work identified two particular needs. One, that residents' care needs were overall higher due to late medications, and two, that there was a low level of Parkinson's understanding among staff. You can see on the screen the chain of events that followed, that 200 staff across all 8 homes in the company went through our Introduction to Parkinson's webinar, that formal processes were introduced to improve the management, recording and monitoring of time-critical meds throughout the homes, and that there were systems in place to ensure this practice remains ongoing. But while this has led to across-the-board reductions in things like hospitalisation, it's worth coming back to the individual resident and the impact that being cared for by staff with greater levels of Parkinson's education had on that person. The issues the resident experienced to do with mobility, anxiety and a propensity for falls were very significantly reduced by the policies and practice introduced post-education. So we can see that undergoing education from the Excellence Network can achieve an upskilling of staff and can bring about clear, measurable improvements to the lives of people with Parkinson's. So, what can you do? What can you do? We've got some action points, as Tracy mentioned at the start of the session. Please access the Learning Hub for all your Parkinson's CPD. The QR code is right there. Sign up, start a course, have a look around. That's the best thing to do. That's the best place to start. Share with your colleagues and teams and organizations. We have extensive feedback which says that learners who have gone in interested in a course which was associated with their own professional area have taken other courses and have been able to use that and apply that to develop their own experience and perspective. So sharing information about the Learning Hub amongst your colleagues and teams is really, really helpful to us and to the improvement of practice overall. We love it when you talk to us. We love it when you give us feedback. We love it in particular when you share your impact stories. And if you're interested in the point that I was making around subject matter experts, we would be delighted to hear from you if you're interested in working with us on projects in the future. So please do get in touch. All you have to do is use the QR code and check the website. So that's the end of the presentation. So what I'm going to do now is, well, I'm going to click that slide and say any questions. As Tracy has indicated, there are some questions which were submitted beforehand, and what I'm going to do is I'm going to go through the answer to one of those, and then I can't see the chat, so I'm going to need to rely on Tracy to manage that, and interrupt me as is appropriate. So the first question that I've got to refer to is from Gillian. Hi Gillian, thank you very much for your question. It's very hard to find advanced training for AHPs in Parkinson's. Most courses are quite medically focused. Would you have any plans towards advanced training programs, either for specific professions or MSc level courses? So the answer to that question is that at present we're building our education offer and repurposing current course content. So at present, our focus is on developing a curriculum from foundation level upwards, as I mentioned, to ensure that we have a natural learning pathway or progression. For advanced level learning, we'll need to do some kind of scoping work around what is needed, for example, by profession or by symptom, and balancing that up with what is currently available and what we would be able to provide with regards to additional learning. Tracy, I can see that there's one message in the chat. That's all that I know.
That's fine. There's no questions in the chat at the moment. Okay. So I think we've got time for maybe one or two more questions from the pre-submitted.
Splendid. Okay, so that's to do with, I had a question to do with Parkinson's and hypertensives. So we're planning on developing intermediate and advanced level courses on medication that will cover polypharmacy, plus the mechanism of how the medication works. This could include sections on antihypertensions associated with reduced risk of Parkinson's, whilst others can worsen orthostatic hypertension in people with Parkinson's. But the point is really to do with development of our learning in pathways kind of terms, but we're definitely thinking about the next steps in terms of specifically to do with medication related provision after the foundation program. Perhaps a last question then is to do with Parkinson's and statins. So again, we're making a similar kind of point. We're planning on developing intermediate and advanced courses on medication that will cover polypharmacy. Studies on statins have shown conflicting evidence, with some suggesting they can potentially reduce the risk of developing Parkinson's and or slow progression, but other studies have shown increased risk and no particular effect on progression. As this is an area of research currently, if it becomes a known treatment, then we would look at including it in our education offer to do with medication. So perhaps one more, and that is to do with, this is a question from Liz. Hi Liz, what training is available in Parkinson's management for physios in the west of Scotland? Well, really, Liz, as I've been sort of talking about, our provision is basically online, so geography has no influence on matters. If you have an internet connection, you can participate. So we have there's an AHP induction which runs twice a year. That's a 6-week course in online self-directed learning. We've got essentials courses which are relevant. That's as I've mentioned, to do with physio, to do with physical activity, to do with exercise. We have our existing foundation module for health and social care professionals. We've got the course on to do with bone health, as I mentioned, and indeed there's an allied health professionals learning library. So there's extensive services upon which you can draw to inform your development as a physio in relation to Parkinson's. Right. Okay then, Tracy.
Good.
Would you like to
I will
make
take
some
over.
closing remarks?
Thank you very much, Mike, for taking us through a clear and comprehensive presentation. Just to let you know what the next steps are, that at the early part of next week, you will be receiving an email from us. And in that email, you'll be containing links to an evaluation form. Please do take 5 minutes to fill that out and to give us that feedback. It will also contain a link to this recorded presentation for you to re-go back over it if you've missed some points, or share with your colleagues. We will also be including a document which will go through the questions with some of the answers. We haven't been able to give all full answers to all the pre-submitted questions. And we'll also make sure that you have the correct links to the areas of the website and to our learning, along with the QR code, so that you can find all the education that Mike has spoken about, and also link back into the whole Parkinson's UK Excellence Network. And really, that's all that's left for me to do, is to say thank you very much for spending a half an hour with us on a Friday afternoon, Friday evening here on World Parkinson's Day. But if you have any further questions or anything that comes to mind after today, please do reach out to us. Our email is education@parkinsons.org.uk, and we'd be more than happy to have conversations with you on anything around Parkinson's and education. So thank you very much for your time, and we look forward hopefully to seeing some of you in the future. Have a good evening. Thanks very much.